It's time for a segment we like to call What's Up, Doc, where we spend time with the experts from Mercy Health. And, well, this morning we're going to talk about, that warm summer weather and more time outside and, bringing a risk of contracting tick-borne illnesses like Lyme disease. So we thought we would bring in an expert, and that's Dr. Bob Tiballi, adult and pediatric infectious disease physician at Mercy Health. He's going to join us to explain the dangers of seen and unseen tick bites on kids and offering some tips to stay safe while we're outside enjoying the great outdoors. Doctor, good morning.
Good morning to y'all.
How you doing this morning?
I'm doing pretty good. I'm trying to stay away from ticks here.
Good.
A lot of people around Rockford area and in the rural areas, extending out westward and up through Wisconsin, don't really realize the depth of illness that Lyme disease can cause. But almost everyone in this area is at risk for acquiring Lyme disease because the tick population around here is so dense, and the infection is widely broadcast over this area. Now, these ticks that people get exposed to are very, very small. Most people don't see them, and if they ever do see them, they think it's a blackhead. They're about between the size of a poppy seed and a sesame seed. It's not the big deer. It's not the big deer tick. It's not the big dog tick that you might find on your dogs. These are very tiny little things. And if they stay attached for more than 24 hours, they can transmit any one of 4 or 5 different illnesses, or you could get any combination of illnesses. Now, there's something called Anaplasma, which is a big problem in horses out here in the northwest Illinois. There's Ehrlichia. Those two tend to cause very high fevers and mental status changes. Older adults can present with almost like near coma presentations, but younger people tend to have very bad headaches. Lyme disease, only 80% of people with Lyme get the rash, the classic target rash. Sometimes it looks like a regular cellulitis where there's no blanching in the middle, but it's important if you think you might be at risk for that to seek out your doctor. And really, you kind of, in most situations, have to be your own best advocate about thinking you have Lyme disease because, just to be fair here, a lot of doctors don't recognize it, and then they don't treat it appropriately early on. It's much easier to take care of it early with just a couple weeks of an oral antibiotic than take care of it after it's been set in on you for more than a year or so. I see patients from multiple state regions that come to see me. I'm one of the unusual few infectious disease doctors in the United States that will actually has a passion for taking care of Lyme. Principally because I had very severe advanced neurologic Lyme disease in the past with Bell's palsy, much like you talked about yesterday with Tom Seaver. And so I understand what patients go through when they have Lyme disease, and in many situations, a lack of understanding by the medical care, because you actually look pretty good. You look okay. It doesn't look like you're sick, but inside, patients with advanced Lyme disease have very, very, very severe issues. Now, what can you do to keep your child safe this fall? Keep them out of leaf piles. Lyme disease comes to you through the tick. The ticks come to you through rodents and mice. Mice and rodents like to go through leaf piles, and then they drop the ticks off their body in those piles, and a lot of kids get bit with ticks in those leaf piles. So although I enjoyed jumping in them when I was a kid, we could say maybe during the age of COVID you shouldn't be doing it, but it's not a good idea.
Hey, Doctor, real quick, I want to ask you something. We've heard about Lyme disease a lot around here, obviously, but the symptoms of it. It's always been kind of a nebulous term. Like you hear Lyme disease, you don't want it. I personally, don't know what the symptoms are. Like what kind of afflictions do you get if you come down with Lyme disease?
Yeah, what would be a heads up for us?
Well, the symptoms are kind of all over the place, and everyone is different. But very commonly, you're in an area where you might be at risk. You go home, or you're at a cabin on a lake in Wisconsin, or you're out in the field or putting posts out there or repairing something. But you may get fevers and chills, very low grade, not like you're getting influenza, but maybe like 5% of the fevers and chills you get with influenza. You might get fevers up to 101.5, 102, headache, light might hurt your eyes. Sounds may be very loud to you and painful to your ears. You might get this rash. You might get tendon inflammation, tendonitis, where joint pain, that usually comes later. But usually it's low-grade fevers and chills. You think you got something. It's like it's going to get bad tomorrow, but it never gets worse than that. And then it can go away. Like I say, 20% of people don't get a rash. 80% do. They're very soft signs. It's not overwhelming. And when people do get infected with Lyme disease, the human body itself cannot rid itself of the Lyme disease without antibiotics. And very similar to syphilis, it can, because they're kind of cousin organisms. But I'm not saying it's syphilis. But they're very similar, the way they appear and the way they live in the human. But you can have initial symptoms, and then they can kind of quiet down. And then late, months or years later, people can develop neurologic problems like Bell's palsy. They can develop carpal tunnel syndrome. They can develop a migratory arthritis that can be very, very painful, almost like a razor blade in a joint, that can last for 5 or 10 minutes and then go away, and then go from knee to hip to other knee to other hip to wrist to elbow. A very bizarre set of symptoms, which is one of the reasons why a lot of doctors don't really kind of recognize it, to be honest with you. Early on, it can be treated easily with any one of a number of oral antibiotics. But again, getting back to avoiding getting it in the fall season, which is one of the intense seasons to get it. If you go outside, we'd recommend you wear loose-fitting, long-sleeve clothing, including shirts and pants, that you tuck your pants inside your socks. I know that sounds pretty nerdy, but it actually helps the tick avoid ticks, because the ticks will light on your clothes, will march up to the nearest skin, and then bite there, and that's where they attach. So we see the top of the sock line, you see it at the belt line, the bottom of the short pants line, the bottom of the sleeve, along the neckline of a shirt, and the hairline. With children, you'd want to do a tick check every night before they go to bed. Preferably, you'd wash your child with a bath. The ticks don't like water. Sometimes they'll detach if you have take a shower or take a bath. But again, they're very tiny. They aren't like the ticks you find on a dog. If you see a little, bumpy, hard spot that's about the size of a sesame seed or a poppy seed on your child at their hairline or whatever, you got to try to. You can scrape it off usually with your fingernail. They don't like to burrow into the skin like the adult ticks do.
So they'll hang around on the surface to where you can get rid of them. It isn't one of those that they attach themselves and then become invisible.
That's right. They attach for a blood meal, and they're on for usually less than 48 hours. And then once they're satisfied, they detach. They're not adult ticks. They're just growing ticks. They're called nymphs. They're like analogous to a human. They'd be like a 6 to 8 month old human. So they're like baby ticks.
Will they hang around in your house? Should one detach itself from you once it's decided that your buffet is plenty and they're done for the time being? Then are they around the house looking for another plate?
Yes, they can do that, especially if you have dogs that come in and out. Dogs can carry them on their coats. A lot of people use these pills now that get absorbed into the dog and the circulatory system, and if a tick takes a blood meal off a dog, it dies. But if the tick is just hanging out, taking a ride on your dog's coat and comes in the house, it can detach and go after you. The commonly used flea and tick powders and shampoos and such for dogs that contain something called permethrin, they actually kill ticks. That's the same active ingredient when you like quote flea bomb your house. That's permethrin. I personally flea bomb my house in the spring and the fall. There's safety precautions you have to do with that, but that's very helpful for killing any kind of ticks or fleas inside your house. And so we have a lot of people that go to their cabin or whatever on the weekend and they crawl into bed and they get out of bed the next morning with a tick on them. That's not uncommon. They can exist in your house.
If I find a tick on myself or my kid, obviously I'll be looking for symptoms. But how likely is it to catch Lyme disease from one of these nymphs? Do they all have it? Is it 1% of nymphs? What's the risk there?
Well, very high percentage. They actually do these studies in states, and there's a very high percentage of the ticks in our area there in Winnebago County and such. Very, very high percentage have Lyme in them. And so we assume the tick has Lyme in it. And so the major question is, how long has the tick been on? So there's been studies that have shown that if the tick is on for less than 24 hours, then the chance of transmission of Lyme disease is relatively low. But if the tick's been on for more than 24 hours, then the transmission is high. Me personally, since I've suffered through, very severe Lyme disease myself, it took me more than a year and a half to recover. I'm very aggressive, and if anybody has a tick, I usually put them on at least a week to 2 weeks of an oral antibiotic that almost everyone tolerates. That's usually a medicine called doxycycline. And for young people, either a medicine like amoxicillin or azithromycin, the so-called Z-Pak medicine. They're all very effective for treating early, post-exposure Lyme disease. We call it prophylaxis, but you might call it post-exposure Lyme disease. So it's really important if you see that to talk with your doctor about it.
Is there something you can put on? I know people go out with mosquitoes and everything else, cover themselves with off or pick your favorite brand and all that. Do these sorts of bug sprays have any effect on ticks?
Well, off has DEET in it. And DEET you can buy in many different preparations. I usually recommend a 40% preparation of DEET. Now, that's a kind of a repellent. It interrupts the insect's ability to detect you're there. So it kind of, it's an invisible shield, so to speak. Some people get 100% DEET, but that's really no more effective than 40% DEET. It just lasts longer. But there's something called permethrin, and I talked about this before. It's a naturally occurring substance, initially from chrysanthemum flowers. Now it's synthesized in a laboratory, and this permethrin is actually a neurotoxin to fleas and ticks and other insects. It's in the stuff that you spray hornets' nests with and such. It's actually dangerous to cats, but it's safe for dogs. It's safe for humans. And you can buy it in a spray. You can spray your clothes. You want to lay out your clothes and spray them. And fully, you don't want to put the clothes on and then try to spray because it doesn't really do a good job. But if you spray your clothes with permethrin, or if you soak your clothes in a dilute solution of permethrin, that's PERMETHRIN, your clothes, if you soak the clothes, are effective for 3 months despite recurrent repeated washings. If you spray your clothes, it's good for at least a week, so that if a tick actually gets on your clothes, it'll die. So I like permethrin. I try to get people to use it. It's not for skin use. But it's for clothes use. And DEET, neither one of these do we recommend that you put them on young children because their skin allows a lot of things to be absorbed through it. But older children, toddlers and such, you can spray them up with a DEET. You could put the permethrin on their clothes. I don't go out in the woods. I have property out near Galena that I'm out every other weekend working, clearing brush and stuff, but I don't go out there without my permethrin sprayed clothes or permethrin soaked clothes.
Well, and he's the expert. You guys should be paying attention to this. Unfortunately, we're out of time. Dr. Bob Tiballi is the adult and pediatric infectious disease physician at Mercy Health. Doctor, thanks for coming on with us. This has been very enlightening and really full of information. We appreciate you taking time out of your day for us.
Very good. I'm happy to be with you, and my goal is to try to prevent people from getting sick from Lyme disease. Hey, thank you very much.
Real quick, Doctor, one more thing. You and I talked for a second yesterday when we had some problems connecting, and you listened to a little bit of the show. I found out you're a big Mets fan, and you went to medical school to be close to Shea Stadium. I just wanted to offer my condolences both for the passing of Tom Seaver yesterday and also for being a Mets fan.
Yeah, and I offer my condolences to you, unfortunate Cub fans.
Okay. Oh, good. Now you got it started with him. Now you got it started with him.
We're going to bring up 69.
I'm going to break the two of you up right now. Doctor, thanks a lot for your time.
Thank you very much.
Have a good day. 8:50. Oh, he wasn't ready to fire back at all.